Hi folks, Coops here from Energia. Hope you like my video channel. Today I want to talk about a very common tendonitis issue that crops up if you do a lot of pull-ups, especially bicep type pull-ups with the knuckles pointing forward. If you do a lot of weightlifting and grip work where you work a dumbbell like that, or work an Olympic bar, anywhere where you're doing a lot of gripping, you often get a tendonitis issue, pain, inflammation arising on the inside of the elbow. Sometimes it's called golfer's elbow. It can create real problems. You find every time you try and grip a bar, severe pain attaching to this flexor section of the forearm or even up into the lower bicep attachment point. And you can see it's quite a complicated bit of machinery in there. Quite a few tendons attach at that point there. The bicipital aponeurosis joins in there. It's a bicep attachment point, but it's also an attachment point for all these flexor muscles that run off, you can see, run off down to the lower arm, which are important for grip. Well, what do you do if you're afflicted by pain there? Well, of course, if it comes up acutely, treat it with ice. Some anti-inflammatories might help. Although I've heard that anti-inflammatories for a more chronic condition of this don't help that much. I have this problem chronically at the moment. I've been struggling with it probably for about 3 or 4 months. I've had it before. I've tried massage through these tendons, a very deep massage across the grain of the tendons. You'll find 3 or 4 tendons coming out of this point. You need to locate each one and really press deep into the most painful parts. Rub deep for 2 minutes or so on each point, running across the grain of the muscle. That'll break up all those kind of mixed up muscle fibers and tendon fibers and hopefully straighten them out. If that doesn't help, you can buy a kind of elbow support strap, which takes a bit of the strain off the flexors when you're doing the actual work, but I found that hasn't helped that much. Another thing you can do is actually work on strengthening the extensors of the forearm. Very often we do a lot of grip work, the flexors are overused, the extensors are underused. So that lack of balance creates a kind of, just overuse of the interior muscles of that joint. So work on strengthening the extensors by a pressure as you incline. You can use a weight, a small weight, put that on a rest, on a bar, on a chair, and use the weight to pull up and down, and up and down. Or you can use just your own resistance from your hand, put it on your leg, force it down, apply resistance as you come up in a kind of isometric style. And you'll find 2 or 3 sets of 15 reps will really work that extensor muscle. Do both sides, even on the side that isn't in pain, so that you have balanced working of the muscles. Give that a try over a period of time, 2 to 3 weeks. Don't forget to stretch those muscles too. Stretch for those flexors, palm down, pulling back on the palm like so. You'll feel it, and as you pull back individual fingers, you'll feel individual tendons being stretched. Really work at stretching those tendons after warming them up with massage, and you'll find that hopefully over time you'll increase strength in the extensors, flexibility and elasticity will restore to those tendons, and hopefully then the pain will settle down. And of course, if it is chronic, just stop doing those intense exercises that really work on exacerbating the inflammation in that elbow. Instead, try alternative exercises. Use a strap to hold on to your Olympic bar or onto your dumbbell or onto your pull-up bar, and that'll take weight off the muscle and transfer it into the actual joints and the bones, and you'll be hanging from your wrist rather than from your pure grip. All of that hopefully will help you, and I'll let you know how I go. Perhaps in 2 or 3 weeks' time, I'll let you know if I've achieved some sort of success in my own treatment. All the best with your training. Take it easy. I'm Coops from Energia. All the best.